Welcome to Decoding Healthcare Research, a podcast by Agora Project. Join us as we delve into the behind-the-scenes world of groundbreaking research and the dynamic healthcare industry, interviewing top paper authors, engaging experts on industry-related topics, and exploring medical subjects that affect our daily lives. And now, your host, Dr. E.F. Rain.
Welcome to Decoding Healthcare Research. I am your host, Efrain Riveros, Dr. E.F. Rain. Today, we are going to be talking about functional medicine, the role of functional medicine, and how, as a scientific discipline, is full of data that can be useful for the health of the patients, how the allopathic physician should embrace this new topic of functional medicine, how Dr. Cass, who is our guest today, approaches the problems from the health of the patient standpoint. And we are going to talk about a lot of aspects, including inflammation, the environment, the gut, and he's going to enlighten us about all these topics. It's a pleasure for us to have Dr. Castel Santana, Dr. Cass. He is a board-certified family medicine doctor, and he's a certified functional medicine practitioner. He did his residency at the University of Maryland, and right now is practicing in Oklahoma. Welcome, Dr. Cass.
Well, thank you. And it is a big honor and big pleasure to be here. So thank you very much, Dr. Riveros, for extending. And I'm very excited to give some of what I've learned and my knowledge in this topic to everybody today. And hopefully it helps our listeners to better understand just another side of what's out there. So yeah, thank you.
That's perfect. So let's start with functional medicine. Nowadays, everybody's talking about it. And what is functional medicine, and how is it different or complementary to what we already know as the medical field?
So functional medicine, when you get to just a one-sentence, one-liner, is really looking at root cause and looking at disease at root cause instead of at a symptom. So it's really finding out the root cause problem of disease is what functional medicine really is. And how that differs from what you and I were trained in the allopathic Western type medicine is, allopathic medicine is fantastic. And I would say, we're some of the best in the world when it comes to treating acute symptoms. And that's kind of how we're taught in school, and especially in family medicine and throughout my residency, it was more or less, what's a symptom with, how's the patient presenting with a symptom, and how do we quickly treat that, right? So we're very good at acute problems. You were in the OR all day, so, find it and fix it, right? And we're very, very good at that. But when it comes to treating chronic disease, we really weren't taught that root cause throughout our residencies and medical school. We're taught it, but we're not told what's important and the pieces to remember. We're not told and how important biochemistry is, and that when you're looking at a patient later on, how important that really is, and really getting down to the cellular function of things is really the root cause of most disease. So that's kind of how I like to explain what functional medicine is versus allopathic medicine, and really also the importance of trying to integrate both styles, because both styles are very important. And I tell my patients that, I have patients that come in that do not want anything to do with medication, but I tell them, listen, if you come in with blood pressure of 200 over 100, you're probably going to need something acutely to lower your blood pressure so that you're not walking around with major cardiovascular risks. And then let's use functional medicine to find the root cause of what is causing your elevated blood pressure. And so I like to have more of an integrative approach with that.
When we were talking offline about functional medicine, you were talking about data, how important data points are in your specialty, and how you approach those data to come to conclusions and put it together in a plan for the benefit of the patient. Can you tell us a little bit more about it?
Yes, absolutely. I think that I've always been frustrated with the amount of data that, one, as a physician, I think that we're, say, allowed to order, right? Sometimes it feels like we're allowed to do things when really we're the scientists. We're the ones that should be driving someone's healthcare and exploring into somebody's healthcare. But it's frustrating sometimes when you feel like your hands are tied and you're only allowed to do certain things. Looking at data points as anything as a business person, as a scientist, as a physician, the more data points that we have, the better, the better protocols we can put together, the better, thought process we can put together for somebody, the better, outcomes can come from more data points. And it's a major roadblock in healthcare nowadays is, as a family physician, when I was practicing in residency, what's your yearly exam and your yearly lab work look like? Well, it was usually 5 or 6 different things that really didn't allow you, again, to look at a root cause. It didn't allow you to look at inflammatory markers or, autoimmune system and anything in depth. And so to me, that was a massive, and it always has been a massive barrier, and still a massive barrier in healthcare, is the amount of data that we can gather for somebody. And, unfortunately, insurance dictates that. And it's a very reactive program and reactive system. And that's what you and I were talking about before is, healthcare right now is more or less sick care, and it's more of a reactive system. Your insurance doesn't cover your labs unless you have a diagnosis. Well, how am I going to come up with a diagnosis if I can't even initially look at your lab work? Because there's a massive cost barrier. In functional medicine initially, and this is pretty much across the board, we run really extensive labs when someone comes in. And, most of us use specialty labs that have been vetted, and they're all appropriate labs that we can use. But the cost, because of technology is different, is so much less. The panel that I use in my practice, if I ran that through your insurance, you went to a standard lab or through the hospital, that's $4,000, and insurance typically doesn't cover all of that. But through a lab that I use, it's $400, and so I can now run those data points and those sets multiple times a year, and it's not going to bankrupt somebody, and that's a massive problem with healthcare nowadays is you get sick, and the next thing you know, you're bankrupt. You're paying off medical bills for the next 10 years. And it's inappropriate to really treat people that way. So.
Yeah, and even more importantly, as you mentioned, is not only the money, but the lack of data that you are subjected to by the mere fact of being afraid of ordering the tests. So going back to this panel that you are mentioning, and we are digging deeper into the functional medicine itself. So this panel evaluates from different angles the situation of the patient. How does it work?
Yes. So again, thinking about functional medicine, and really some key points in functional medicine is, one, mitigating chronic inflammation and understanding chronic inflammation will mitigate chronic disease 85 to 95% of the time. Chronic disease comes from typically your immune system chronically being irritated or turned on. And so looking and going through a full comprehensive lab analysis that does that is very important. So, and even understanding your basics. I think a lot of us physicians forget our basics, and how much a CBC can tell you about chronic inflammation. There's probably plenty of docs out there, family docs included, that could look at a CBC and overlook the fact that, oh, there's elevated granulocytes. Okay, well, let's talk about your history. Have you been bitten by a tick, right? Are there signs of chronic inflammation in there that then need to be fished out your history. So there's lots of data that we could gather from a full lab analysis, including, full thyroid panel that goes into depth, a full autoimmune panel that goes into depth, hormones, again, your CBC and what your blood looks like. So all of those things we look at, and we even look at some micronutrients initially, and cardiovascular risk factors that are linked to some micronutrient deficiencies. Again, with the broader understanding that we need to get to a root cause of what's causing chronic inflammation for that person. And it could be that simple, and to simplify things for my patients, that's how I explain it. I say, listen, we just got to find that inflammatory process in your system and what's causing it. It's either going to be gut related or it's going to be cellular related. And again, if we can mitigate those things and find it, then we could really take care of most of symptoms and chronic disease.
Going back to the concept of inflammation, that in my opinion is central. Inflammation occurs as a response to exposure to the environment, right? So in terms of functional medicine, how do you conceive that relationship between the port of entry, like the GI system, and the environment, and probably other aspects like toxins start playing a role? How do you integrate all that?
So I initially paint a picture, and a visual picture for a patient is an iceberg, right? You're going to have inflammation that you can see, and initially that we would everybody looks at and we should look into, and then you've got what's underneath the surface. And I break it down into those two layers where you have your gut and then you have your cellular level. And if you think of it just statistically, you have 80% of your immune system in the GI tract. It's the portal to everything else, right? And it's one cell thick. And so it doesn't take much for chronic inflammation to really present itself through the GI tract. And that could come from, stress. It could come from pathogenic infection. It could come from the food that we're eating and toxins. But once we get to that layer and we start breaking it down, then we're set up for that chronic inflammation to really take place. And there's triggers that also play a factor with the breakdown of the gut. And again, in functional medicine, it is so important to get a history. And in medicine in general, it's very important to get a history. But, one of my attendings always used to tell me, just sit and listen, and the patient's going to tell you what's going on 90% of the time. You just got to listen to the history. And so we really focus on triggers throughout your life, though, because those triggers are also lowering your immune system to where now the whole symbiotic system can break down if you're having triggers. And those could be any stressful events in your life. And it can be from the time you're born to now. And it could be anything from, stress to vaccines for certain people, to, marriage, to school, to any sort of chronic tick-borne illnesses, Epstein-Barr virus. These are all triggers that lower your reserve tank and your ability for your immune system to manage these chronic toxins that build up over time. Now, again, your gut is just a major central part of that because of the fact that so much of your immune system is in the gut. And that's so important. From there, then we discuss at a cellular level what could be causing cellular inflammation. And these are things like micronutrient deficiency, and genetics. So we like to check, methylation genetics for most of our patients, whether or not you can methylate properly, and your detox pathways. Are your detox pathways open or turned off? And is that leading to a deficiency? If you have a deficiency, if you're not methylating your vitamin Bs, and your mitochondria aren't functioning well, guess what? The rest of your cells aren't functioning well, right? Because you're not producing ATP properly, or you're not detoxing certain things properly, and maybe you have hormonal imbalances. So all those play a role, but once we get to that cellular level, then environmental toxins really play a role, which we're all around. And there, some people were born into different situations and are around more toxins than others, molds, metals, chemicals. But the fact is, we all have something, and I've tested thousands and thousands of people, and we all have a level of something. It just depends on when your body has had enough, right? So when that reserve tank gets low enough and your immune system can't balance those toxins in your body, then cellular inflammation, let's call it, takes place. And so that's how we kind of break it down. That's how I break it down in my practice for my patients in regards to chronic inflammation, the gut and then cellular. And so we work through those two layers to improve those two layers so that overall your immune system's relaxed, right? And so, and I deal with a lot of autoimmune, diagnoses in my practice. And it's just working through that process of getting your immune system to really settle down and taking away those chronic inflammatory agents.
That's actually very interesting. That concept that you are mentioning of inflammation at the cellular level, especially when we talk about the GI tract, how does the microbiome fit into the equation?
Yes. So the microbiome, and when we talk about this, people, I know our patients get confused because in school we're all taught that bugs are bad, and even we're taught that throughout medical school that bacteria, viruses, they're all bad. So they don't understand, oh, wait, we have a microbiome, what is that? And those are good. So I try to impose and explain to our patients that we have trillions of cells and we have trillions of bacteria in our body, in our GI tract in particular, but also on top that are helping us out. It's part of a whole symbiotic system. And when that breaks down, those are some of our first line defenses, because if you remember, our GI tract is one cell thick, so we have to have other defense mechanisms in place. And that microbiome is there to tell us basically what's going on in the external environment before it gets internal. And so any bacteria is going to break down decaying material. That's what it's for. It's to break down things. And then our microbiome tells us what that is, really through messenger RNA and through bacteria poop, right? And so bacteria poop, messenger RNA kind of tells us in our body, hey, you just ate this and it's good or bad. And now turn on a pathway, good or bad, right? So if you just ate a bunch of chemicals, well, those are going to come through, and those will usually get into the cell. Usually most toxins are lipophilic. They get into the cell, they get into your mitochondria, and then they're really, really hard to get out unless you're actively pulling them out with binders or pushing them out. But back to the microbiome, your microbiome not only breaks down material to tell us what's going on, give us nutrients, give us neurotransmitter productions, those sorts of things, but it's also setting up a layer of protection through a mucosal layer that assists in all of those things I just said, but also is a protective mechanism and barrier for us and for pathogens as well. Because your microbiome, 97% of bugs through that are helping us. But there are other bugs that don't want to help us, and parasites and things like that our microbiome helps us, eradicate or protect us from. And then we get into the layer underneath where, if that defense mechanism is broken down, that's when our immune system starts reading things, it's either going to be, proteins from food that's not supposed to be coming in, bacteria that's not supposed to be coming in, or other agents that are going to then cause a chronic inflammatory response. And, a lot of this stuff, causing chronic inflammation can be good foods. It could be things that we think are good for us. It's just a breakdown of the barrier that's causing it.
Given all these beneficial effects of the microbiome that you just mentioned, what can we do to try to enhance those beneficial effects?
Well, it really starts with what we do with this, right? So what we're eating is the first thing that we can do to improve our microbiome outcome. And what I, again, try to impose on my patients is the quality of food that you're putting into your body. And we all get into the bad habit of unconsciously putting things in our mouth and going home and eating things that we don't even know what's in it, and unconsciously going through the day. So I try to, just kind of let my patients know, got to get in the habit of consciously eating. And that step is getting away from the processed foods and getting more into the foods that what it is. It's think like a caveman is what I tell people. And if it's meat, if it's vegetables, if it's fruit and it's natural, fantastic. From there, try to get as organic as possible, because again, we are all around toxins and chemicals, and even good fruits or good foods like fruits and vegetables can have chemicals on them and can be problematic for you if it's not actually organic. And so that's the first thing I try to tell people is start with good food, cut out the processed things. That is going to shift your microbiome. The more processed that you eat, the more chemicals potentially that are associated, the more carbohydrates that you put in your system, processed sugars and things like that, the more breakdown, again, you're going to have through a dysbiosis. You're going to get certain bacteria that overgrow. You're going to get yeast that overgrow. You're potentially going to get now parasites that kind of set in. So it starts with what you're putting into that system. And then it really, for me, goes into sleep. Sleep in anyone's medical history is number one. You have to sleep. It doesn't matter if you've got hormonal problems or abnormalities or anything else. If you're not sleeping, it doesn't matter what else we're doing. You're not getting that recovery period throughout your body. Your parasympathetic system isn't working, and you're more sympathetically overloaded, which tends to put your cortisol, and your adrenal glands on overdrive. And so your body's always stressed. So sleep is very important for your gut. And it does have a lot to do with cortisol. So again, when you're stressed, and let's say you're not sleeping or you have sleep apnea and your cortisol is constantly up and down and bounding, that cortisol breaks down your mucosal barrier. So not only does it change the bacteria, but it also it lowers that mucosal layer by decreasing the IgA production in your system. And so automatically, if you're not sleeping, you're going to have gut breakdown. So sleep's part of that, which is very important. Food, sleep, then we can start diving into some of the other nuances of what's important for your gut, or breaking it down. So hormones have some to do with that as well.
And it's nice how you summarize it. And actually, when I was preparing for our conversation, it came to my attention that you talk about the 5 pillars of health and wellness. And to me, this is intriguing because I see that the approach that you are having is holistic. This is a system-based approach that is a little bit different from what I am used to, because we tend to partition things into compartments. I would like you to enlighten us a little bit more about these 5 pillars and how they embrace the holistic concept of functional medicine.
Sure. And my 5 pillars that I work off of aren't necessarily a full functional medicine. Like, it's not a doctrine of functional medicine, but it does play very well into a holistic approach. And, I came up with these 5 pillars 14 or so years ago when I was in residency, and early on, when I kind of saw the pattern of medicine that I personally just didn't like. I didn't like the revolving door of us seeing patients, every 5-10 minutes. What's your symptom? Here's a med. What's your symptom? Here's a med. And, I thought I was getting into medicine for other reasons and to really help people accomplish wellness and not be on medications and live a well life. And so, some late nights and thinking and conversing with friends and things, I kind of came up with these 5 pillars, which number 1 is medical wellness. And we all have to be medically well. And that's, it sometimes, again, may be integrative, where it might be medication for a bit, but finding the root cause, right? If you have a thyroid issue, if you've got autoimmune issues, if you have, blood pressure, cardiovascular issues, we need to be medically well to be a well person. Number 2 is physical wellness. And physical wellness with diet and exercise can take care of a lot of number 1. If you're moving and you're eating good food, you're typically going to be a well person, in regards to chronic disease, typically. Number 3 is mental wellness. I think that's very important. I think it gets overlooked quite a bit in medicine. I think going through training, we were taught, what's a mental, what are some of these symptoms, and what's the DSM, diagnosis, and then what's a medication. And it always bugged me, because I always thought, well, there's got to be something else going on. Why aren't we treating the brain organically? It's not like you're deficient in Lexapro. You might be deficient in serotonin, or you might have a dopamine production issue. Like, we're not looking at the brain organically. So I take a different approach to mental wellness. I like to look at it organically. Again, a lot of your gut brain connection is tied to each other. Again, 70-80% of your serotonin is produced in the gut. And so if we have someone that's suffering from depression or anxiety, that's one of the first places that I look, especially someone that has, generalized anxiety or anxious symptoms that just kind of maybe come and go. It could be a parasympathetic issue. It could be vagal nerve stimulation. So I look at mental health a little bit differently. Spiritual wellness, I think, is very important. That's number 4. I'm not in my practice praying with everybody, but I want people to understand how important it is to find a higher power, find something that humbles you. If it's church, if it's yoga, if it's going out into wilderness, if it's something, but I think it's very important. And there's been lots of studies behind the well-being of what being spiritually well or spiritually enlightened means, right? And what that does for you, how it can raise your oxytocin and dopamine levels, and actually how it can actually improve gut health. So for me, that's important. And number 5 is aesthetic wellness. We don't all look the same, but we'd like to feel good about how we present ourselves. Mm-hmm. Some of those things are more important to others. Typically when I have somebody come in, they'll fill out a diagram, a pie chart with what is more important. We don't have to touch on all 5 when they first come in, but we're going to go through all of them and see if there is something that we need to kind of focus on. So those are my 5 pillars of health and wellness. I think those keep people well. If I were to add a 6th wellness, it would be financial wellness, because I think financial wellness stresses everybody out. So, the understanding money and being financially independent, I think is so important for people. That's a whole other topic, but
that's quite interesting. And bringing all this into practice for a patient who comes to your office, I assume they come for different ailments. how do you approach them? What does that patient what should they expect from you when they come to see you?
So most of my patients now, my new patients that come in are coming in from word of mouth recommendations, and 80% of those 80% of those people are stuck in the system. So they may be in their 40s or 50s, and they're starting to see no light at the end of the tunnel, right? They're starting to feel the pressure of the medical system where they're getting on more medications, and they're just not getting healthier, and there's no answers. And that's my typical patient, is a very frustrated person that wants answers. And again, what we've talked about in the last 30 minutes, that's what I talk to them about. When they first come in, I tell them, we're going to run a full analysis on you. We might find stuff, we may not, right? But we're going to get a full analysis, because that's initially how I'm going to be able to assess you at a cellular level, basically. And we discuss what those results could look like. We discuss some statistics in there. We discuss some of the genetics that we might be looking at, because I want people to understand that they're coming into a newer type of system, and we'll talk about this as well, that a lot of these things aren't covered by insurance, but that's not a bad thing. A lot of people think, well, if it's not covered by insurance, it must not be good, or must not work, or that's not the case. And so talking through some of those misconceptions and those concerns are our initial discussions. I also talk to them about what we find, or what I see highly statistical. And what I discuss with everybody is, hey, nobody has a perfect gut. It doesn't matter if you're eating, celeries and carrots all day. It doesn't matter. Nobody has a perfect gut. We always find something, a dysbiosis, or digestive enzymes low, or something. Now, we don't necessarily test everybody unless they're having symptoms. So my first line is going to be history always, full analysis. And a history for functional medicine always includes environmental history. So we go all the way back to when you were born, how that was it traumatic? Were you breastfed? Did you get immunizations? Did you go through that process? Did you have any issues with that? And they may not remember, but then from there, where'd you grow up? Right. And I'm in Oklahoma, so I have people that travel from all over the place. We have a lot of farmers. We have a lot of people that grew up on ranches, and grew up on well water, or they sprayed toxins, or they lived in a moldy home. Those are very important, because again, those are the toxin burdens that build up over time. And I need to get a good assessment of what your toxin burden might look like, because that might indicate, hey, I think we need to do a full toxin analysis to start off, instead of later on down the road. Because usually it's gut health, then toxins, then I test for pathogens if we haven't been able to clear symptoms in that pathway. And so that's the process I lay out for my patients, and the timeline for that, because the gut working through the gut can take us 4 to 5 months to really kind of get a good stronghold on symptoms. If there's a lot of toxins in there, that can take another 6 or 7 months. And so that whole process for somebody, and having expectations laid out initially, is very important. We live in a society that they want their dopamine real quick.
Yeah.
They're constantly on these, and they want their dopamine real quick. And that's just how our society's set up, and there could be frustration, and if there's not expectations laid out initially. So I just tell them, hey, this is a long process. You might feel really good in 4 to 6 weeks, or it might take 6, 7 months. So that's kind of the process that I work through my patients with.
I see. And this has been a wonderful conversation, very productive. And as we come to a close, I want to wrap it up by saying thank you, Dr. Cass, for being with us today. And as we spread the word for functional medicine, I think people are going to be more and more interested. And actually, for our audience, the link to the website of Dr. Cass is going to be in the description, as well as his contact information if you are interested in learning more about what he does and the way he practices his functional medicine. Thank you, Dr. Cass, for being with us today.
Thank you for your time. I appreciate you, and I look forward to further conversations in the future for sure.
Thank you so much for tuning into this episode. If you enjoyed it, please don't forget to give us a thumbs up and share it with your friends and family. Make sure to subscribe to our channel and hit that notification bell so you never miss an episode. If you have any questions or thoughts about today's topic, we'd love to hear from you. Feel free to leave your comments down below. For more information and references related to today's discussion, you can find them in the video description below. We appreciate your support and look forward to having you back for our next episode.